With me now, I have Michele Nakata, Supervisor of the Medical Cannabis Dispensary Licensing Section from the Office of Medical Cannabis Control and Regulation. Thank you so much, Michele, for joining me on this episode. How are you doing today?
I'm doing good, thank you.
So for those watching who may know a little bit about medical cannabis a lot or maybe not know anything at all, what exactly is the Hawaii Office of Medical Cannabis Control and Regulation? And what's your role? What do you do there?
Okay, so the Office of Medical Cannabis Control and Regulation, or OMCCR, which you were instrumental in establishing, joined together two previously existing separate programs, the Patient Registry section program and the Dispensary Licensing program. OMCCR is responsible for implementing the medical use system, primarily to ensure that qualifying registered patients have safe access to cannabis for medical use. The program, as I mentioned, is comprised of the Patient Registry section, which oversees the registration of patients with qualifying medical conditions, and the dispensary licensing system is responsible for regulatory oversight of Hawaii's 8 dispensary licensees. I joined the program in December 2018, primarily to supervise the dispensary section, but also I was asked to help stand up the new combined Office of Medical Cannabis Control and Regulation.
So you come on in 2018, and then by 2020, we're in the middle of a pandemic, and you're dealing with that, right? Okay, we'll get back to that later on. But for those of you not familiar, you got a little bit about the dispensary system, but can you tell us a little bit more about the dispensary system that might be interesting to our listeners?
Sure. So as I mentioned, Hawaii has a total of 8 licensees statewide. 2 are on the Big Island, 2 are in Maui, 1's on Kauai, and we have 3 on Oahu. So Hawaii has what's called a strict vertical system. And what that means is that each of Hawaii's licensees is responsible for everything, from cultivation to manufacturing products, packaging, and all the way through retail dispensing. They are allowed to subcontract various aspects of their operation, but each licensee is solely responsible for the entire operation. Each of the licensees is allowed to have a total of 2 production centers, and that's for cultivation and manufacturing. And then they can have 3 retail locations each. Currently, we have a total of 28 facilities statewide, and that includes 11 production centers and 17 retail locations. Each of the production centers is allowed to have up to 5,000 cannabis plants. So that basically means that each licensee is allowed to cultivate a maximum of 10,000 plants. In order to keep track of everything, the state maintains an electronic seed-to-sale tracking system, and that the licensees are required to also utilize. The system tracks each plant and material from each plant, from growing through manufacturing, through laboratory testing, to retail, and also through destruction. And this means that, in addition to us being able to track plants and plant material forward through the system to make sure that there's no diversion, we can also backtrack any patient purchase to the actual source plant. And that's especially important in case, there's an adverse event or something, is identified that necessitates doing a product recall. Also, unlike many states, Hawaii's rules require that every single batch of cannabis or manufactured cannabis product is required to be tested and meet all laboratory standards before it can be released for retail dispensing.
So really, the Department of Health has continued to maintain a safe and regulated system, is what I'm hearing from you.
Yes. So some people would say that our system is a little overly strict, and I think that's actually been a good thing. Some of the states that implemented early look back and say that it's a good idea to start really strict. And as you learn more about the system and about the industry, realize what it is that you can scale back on and loosen up that way, instead of doing what some other states have done, which is start very open and then are struggling to try to reel in different aspects of their cannabis systems.
Sure. Okay, I want to get to your legislative priorities, but before we do that, since you mentioned it, have we ever had to recall any products in the a couple of years that the dispensaries have been operating?
No, we have not. I think probably the closest concern that since I've been on board was when a couple of years ago, when there was a nationwide outbreak of EVALI that was related to cartridges. Fortunately, Hawaii does. For some reason, when we established our rules, we're very strict that the cartridges must contain only cannabis-derived oils. So we did not have an issue with the types of additives that were associated with the EVALI outbreak. And although Hawaii did have a few cases of suspected EVALI, there were absolutely no illnesses that were associated with any dispensary products.
I think that really speaks well both to the Department of Health and the C2 sale tracking your regulations, and it also speaks to our dispensaries adhering to the rules and regulations. So now that we're in the legislative session, we've got almost a month left to go. What are the priorities of your office in 2021?
Okay, so for this year, I would have to say that priority number one for our office has been to revise our administrative rules. So Hawaii Administrative Rules, Chapter 11-850. I'm pretty embarrassed. The rules have not been updated once since the dispensary system was established in 2015. And we all know that a lot has changed.
So don't knock yourself too hard, Michele, because sometimes it takes departments 5 years to write rules. You guys did it fast. So I'm glad that that's your number one priority. But I'm sorry to interrupt. Go ahead.
No, that's okay. That is definitely my number one priority. Other than that, we would really like to establish a surveillance system for health impacts that are related to cannabis use, and then begin developing and disseminating health messaging based on what that data shows. After all, we are public health. I've been a public health practitioner for over 30 years now. So in addition to ensuring safe access to patients, I feel that it's very important that we be monitoring for other impacts that the movement toward and acceptance of cannabis use is having. For example, things such as youth use and even youth perception of cannabis, use during pregnancy and breastfeeding by women, impaired driving, and impaired workplaces. So, with those priorities in mind, that brings me to this legislative session. What the program really needs is resources. Like everyone else, COVID-19 has had a really significant impact on the Office of Medical Cannabis. We had 6 critical positions, and that includes the program manager, fiscal officer, epidemiologist, information technology specialist, secretary even, and office assistant. They were all defunded as a result of the economic impacts. So yes, we've been operating without any of those key positions. But fortunately and thankfully, 2 measures, one of them a budget bill and the other one an appropriation bill, they're both still alive and moving forward, and both of them reinstate funding for these 6 positions. So cross our fingers that they will make at least one of them will make it to the end, and we will be able to finally recruit and fill those positions and fully operationalize the office.
I think, here in the House, we're very supportive of making sure that critical services get funded. And I think in this arena with the medical patients, this medical industry, that we do need, in fact, those positions. So I'm hopeful. It's still tough because, state revenues are just taking such a hit. But we're working for that. So with laws and regulations that are new, complex, and constantly evolving, as the cannabis industry grows nationwide, what types of things that make your job difficult as a regulator here in Hawaii?
I would say that I think that the most challenging thing has been that there's no roadmap to follow. This is all new territory, especially for Hawaii. And the fact that cannabis remains federally illegal, it really exacerbates the situation. And, although there's been a lot of states that did implement before Hawaii, every state was different. So the programs that they stood up, they're all very different. So kind of rather than them being, having necessarily paved a way for states like Hawaii and other states to just be able to follow, my view is more that they kind of laid down paving stones. And, what Hawaii and other states have to do is we have to pick those up and look at them and, make a decision to choose what's right for us. And doing this really does. It takes a lot of time and effort. And this is kind of the reason why the establishment of the Cannabis Regulators Association, or CANRA, has been such a great resource. The ability to network with them and learn from other regulators has been extremely helpful.
So let me just jump right in here. What is CANRA? Because I don't think our viewers know that. Just in a nutshell, what is CANRA?
So it's a nonprofit organization that was just formed this year, and it is an association of states regulators. Right now, it is strictly just the primary regulatory agencies responsible for cannabis, and this includes both medical use as well as recreational or adult use. And it also includes those states, a couple of the states are coming on board that are actually only strictly CBD or low THC use. So more and more states are joining. Hawaii was a founding member of CANRA. And we basically work together to try to establish an ideal regulatory framework, build consensus around what kinds of things should be at least the floor for all cannabis programs across the United States. What should be testing standards, packaging and labeling standards, and those sorts of things. And it'll be really important, especially as more and more states come on board, not just with medical use, but eventually with adult and recreational use, because it will allow for interstate commerce and, and movement of products, because there's a uniformity that's established. So I'm really excited about the ability to participate in CANRA. We, as I mentioned, are currently just state regulators. We are going to be expanding shortly to allow for county and municipal regulators, and then eventually with some affiliate organizations. However, because we're still in our infancy, the organization is not yet open to industry or advocacy groups.
I appreciate what you're talking about, because I think it speaks to the complexity. Everyone thinks that we can just jump right in with legalization, and that's just not the case when you think about the complexity across states, within states. We have a special, unique position where we are, not even connected to the mainland America. So questions about, trade and commerce are all very big. I have you for 40 more seconds. What do you envision for the future of cannabis in Hawaii?
So right now, my focus is really on the medical use program. In my opinion, it's still in its growing phase, and it's like cannabis plants. They need the industry needs careful cultivation and care to reach its full potential. So that being said, I really have no doubt that we will eventually see legalized adult use here. And my true hope is that we take good measure of what has and hasn't worked in the other states. And, because done right, I think legalization presents some excellent potential opportunities for the state.
I'm so glad you are where you are, Michelle. And I joked, we're not letting you retire. Thank you so much for sharing those insights with me.